All right, we're excited that you're having a BBL, aka Brazilian butt lift at New Life Cosmetic Surgery. One of the things that we like to explain to both ladies, and sometimes we do on men as well, we do BBLs on men as well, is that idea of how do I lay down or do I sit on my butt? And so here's what the studies show. The studies actually show that there is no difference whether you sit down or lay down on your butt. And so you'll find some very, very, very good surgeons that do BBLs and will tell their patients that it really doesn't matter. And they're actually not lying because the studies show that it doesn't seem to matter. However, we still tell people for the first 4 to 6 weeks to try to lay off their butt as much as possible. But we understand you've got to go to work. You've got to do other things in life that requires you to sit on your buttocks. So I think the main thing is that don't stress out about it. There is no, they've looked at this in multiple studies. There is no really significant difference, but I do have people that will sit down on their buttocks area and they'll really think that it caused them to have increased fat loss. So I'm going to continue to tell people just to not stress out about it, but try to avoid sitting on your butt as much as possible. So if you've had a surgery done with us and you did not have a tummy tuck, just sleep on your tummy. Or you've had a BBL with a breast aug, sleep on your tummy and just kind of cushion the breast area. If you've had a tummy tuck with the BBL with us, well then it's a little bit more challenging. We'll kind of explain how you can do that. But some of the things that we often see our guests do is that they'll sit or lay in a little bit of like a foam donut, and you can buy those online. Those are called kind of BBL donuts. I think you could do it for the first week. I think after that, it's kind of hard to continue to sleep in a donut, but that is one option. Another option is just to wedge pillows, to still sleep, on your back area, but wedge pillows to offloads, wedge pillows underneath the posterior thigh area and the low back area to kind of make your own little donut pillow type contraption so that you're able to again sleep right on the buttock area. The next thing is to make sure you're eating really healthy, right? You don't want to be losing weight at all during this time, but you don't want to be gaining weight either. So for sure, do not plan to lose weight in the first 6 weeks because we want those fat cells to survive. But at the same time, don't be gaining a lot of weight either, because that's then often not eating good nutrition, and that can lead to other weight gains, areas that you don't want to have. Other things is that you're going to see some bruising and redness at first, almost all the time. And if you see that bruising and redness, it's going to last for 1 to 2 weeks. It will slowly go away. If the redness feels very, very hot after a few days, please notify us and just make sure that we take a look at it, make sure there's no cellulitis going on or anything like that. It is possible to have what's called fat necrosis, and it's where those little fat cells that die don't get flushed out and they stick around, and you can get some firmness and hardness. Let us know if you start noticing that. It's normally going to be seen anywhere from 3 to 6 weeks after the surgery. And so you'll feel kind of these hard little balls underneath your skin. Let us know that if you feel that. Lastly is that no matter where you go, you're never going to get 100% cell survivability after a BBL. What does that mean? Is that not all the cells that we transfer, fat cells, will survive. So you've got to expect that there's going to be anywhere from a 70 to 80% chance of cell survivability, but that means you're going to go down in your volume anywhere from 20 to 30%. And so that's just across the board. It doesn't matter who you go to. We use the best forms of making sure that the cells survive at New Life Cosmetic Surgery. But in general, you are going to see that go down. So what does that mean? When you first have your surgery done and we seem to over volumized you, do not freak out. It's okay, because it's not going to be that much. Now, if we've used all the fat that you've had and you're like really happy the first few days, because you're like, oh my gosh, this looks great. Unfortunately, we used all the fat you had and that you gave us, or it could be that your skin is super tight and it's impossible to put more fat in there, because when we put the fat in, it just keeps on coming out of the incisions. Those two factors will lead us to maximize the amount of fat that we can place in. So after the first day or two, you're like, oh my gosh, this is exactly what I want. It's gonna go down some. And so there can be some disappointment in understanding that, it's not gonna be the results that you get after the first few days. So what do? Well, sometimes we need to do round 2. And what does that mean? We need that skin to relax more. We need the skin to stretch out over time. And we need to find other areas on your body that we can extract the fat from and then place it there. I normally want to wait at least 6 months to a year for us to do a round number 2, but that's always a possibility as well.